Benjamin Chiri Ampa from St. Carol's School of Nursing. The topic for the day is ethics and ethical codes in nursing. Ethics and ethical codes in nursing. When we say perspectives in nursing, every profession has its origination. Every profession has its discipline. Every profession has its codes and norms. So, how nursing began, the originator of nursing, the culture of nurses, the things nurses believe in, the do's and don'ts of nurses, and as novice nurses, the things that we need to know concerning the profession is what we are coming to talk about in a course called Perspectives, Nursing Theories and Contemporary Issues. So we are starting this course with ethics and ethical codes in nursing. You know, we are all coming from different backgrounds, from our different homes, our different environments, and we have all come here under one canopy called a nursing institution. We have all come from different communities, different mothers and different fathers. And you will agree with me that the way and how Amma was brought up is different from how Kwesi was brought up. And so the way and how we would behave in our personal or individual manner will differ from one other. But as nurses and as a nursing profession, regardless of our origination, our background, regardless of the parents that brought us up, we still have to behave and believe a certain code. We still have to bring ourselves under a common nurturing as nurses. So regardless of where we are coming from, we ought to do something which is in relation to the profession in which we find ourselves. Failure to do so means that you are doing something outside the profession and hence you are being unethical. So the values that you were brought up as individuals were inculcated in you by your parents. Some was done by the school, others were done by the church. Some was done by the media. Social media now is having a lot of effect on us. All these agents of socialization has turned and changed us into who we are today. But where we find ourselves as student nurses now, we need to do certain adjustment and adaptation in order to be called nurses. A nurse must have a special characteristic in order to meet the standards of who a nurse is. And so the difference between values and ethics is that values are optional, ethics are compulsory. Your values as a human being is that you always have to talk to an elderly person with please. But with ethics, you do not have an option than to say please. When we talk about when we want to distinguish between values and ethics, you don't have any choice but to follow the protocols in giving injection to a patient. When we say give it at the outer upper quadrant, you don't have a choice than to give it at the outer upper quadrant. Failure to do so means that you are incompetentness. If someone steps on your toe as a human being, it is your choice to step on the toe back or to tell the person that I forgive. That is a value. But with ethics, you are obliged to conform to those ethics. That is what we are coming to talk about today. So, branch of philosophy concerned with determining right and wrong in relation to people's decision and action is what we are terming as ethics. And morals and ethics are often used interchangeably, but morals are often stated as private, personal standards. And ethics reflects a personal commitment to standards beyond personal preferences. So with ethics, you don't have a choice. It is beyond your personal preference, whether you like it or not. Once you find yourself in the profession, you must, conform to the very things that we see as ethical. So nursing ethics, they are expression of how nurses ought to conduct themselves, refer to standards that govern and guide nurses in everyday practice, such as being truthful with clients. So if a client walks to you with COVID-19, the very pandemic that we are fighting today, and the person asks you, you walk to the person fully gowned in your PPEs, and the person looks at you, and then the person asks you, the person who is in a very distressed state, both in respiratory distress and in a distress state psychologically, the person asks you, will I make it? Will I survive? And then knowing, as a professional nurse, an experienced one of course, knowing what you know, that the person is not likely to make it, you give the person a false hope that, oh, you will make it. With that, you are not being truthful. So if you want to be truthful, I do not mean that tell the person, oh, you are going to die. But you have to find a special way of balancing yourself in between the two, that at the end of the day, you will not seem to be lying, nor seem to be giving the person false hopes. So you need to always also respect the patient. In as much as the patient is an individual and you have to recognize the patient as such, you need to respect the patient's privacy. And by respecting the patient's privacy means that anything that you will do for the patient, any procedure, in as much as it's going to benefit the patient, you need to explain that procedure to the patient for the patient to consent to the procedure before you can go ahead and do it. Now we come to the ethical principles of nursing. One of the ethical, when we say ethical principles, they are the standards that guide nursing practice. So ethical principles, the first one include autonomy. And as I said earlier, autonomy means that you have to respect the patient and also treat the patient as an individual. So Mame Akosua and Mame Ya went to the theater. They all went to do the same surgery, appendectomy. And then Mame Ya is screaming on top of her voice, and Mame Akosua is very quiet. You walk to Mame Ya and tell Mame Ya, are you the only one who has undergone surgery? Can't you see Mame Akosua is quiet? At that particular point in time, you are not using the ethical principle autonomy, because you are not treating Mame Akosua as an individual. Rather, you are comparing Mame Akosua to Mame Ya. Just because one is quiet and one is making noise, you are trying to tell the one who is making noise to shut up because the other is quiet. That is not respect. You must always make sure that you respect the patient and treat them as individual. When we talk about palliative pain, we will be talking about some definitions of pain. And you would realize that, we will learn that pain is whatever the person says it is and whenever he says it does, as by McCaffrey. So, if someone says he is in pain, it is what the person is saying and not what you think. And so if someone is in pain, you need to assess the person's pain and give medications accordingly, prescribe medications accordingly. So you must always make sure that you are being autonomous in your practice as a nurse. Autonomous means that you are using an ethical principle to respect the privacy and the individuality of your patient. Non-malfeasance is that you do no harm to the patient. Do no harm to the patient. In your practice of nursing on the patient, make sure that you do not complicate the patient's condition. Whatever condition the patient came with to the hospital, you have to make sure that the patient do not leave with a complication. So if a patient who came with head injury comes to your unit and then the patient is leaving recovered from the head injury, but rather the person is going to the house with a bed sore, you are being unethical. You have committed a non-malfeasance. You have done harm to the patient. Rather, non-malfeasance says that do no harm to the patient. How will a person develop bed sore when you practice your nursing procedures well? By changing the patient position regularly, and also making sure that the patient eats food that will improve the skin tegel. So if a patient is nursed and the patient is going back home with a bed sore, that is not malfeasance. If you give an injection to a patient and the patient develops an abscess, that is not malfeasance. If a patient's line is infiltrated, i.e. tissued, and then you continue to give the patient IV medication, knowing that the IV line is tissued, whether you know or not, you are being non-malfeasant. So these and more are the reasons why we are talking about the ethical principle, non-malfeasance. Whatever you do must not harm the patient. Beneficence is whatever you do must benefit the patient. That is beneficence. Beneficence is whatever you do must benefit the patient. So what are some of the things that you can do to benefit the patient? You have to give medications at the right time, the right dose, right dosage, and you have to also check all the needfuls, the expiry dates, the route of administration and all. You have to make sure you have checked all that in order to benefit the patient. What are some other things that you can bed by the patient when the patient is looking unclean? You can change the person's bed linens when the person's bed linens are soiled. You have to give the person education which will benefit the patient. So especially when the patient is being discharged, you need to give the patient education in order to ensure that the patient goes home knowing fully what is happening to him or her. Justice. You have to be fair to all, equity. So as a student nurse on the ward, you go to meet your JHS mate, and on that day, you will stand by your JHS mate and make sure that you will provide everything for your JHS mate just because he's your JHS mate. Ignoring other patients, you are not being justice. Just because they told you that on that day there is a member of parliament on the ward, as against an ordinary choco boy, all your attention is on the member of parliament, even though you know that the member of parliament's condition is very, very stable, and yet you take all your attention to the member of parliament and ignore the ordinary choco boy who is dying. That is not justice. You have to make sure that as a nurse on the ward, you will distribute resources equitably so that all and sundry can have access to those resources. Failure to do that means that you are not being justice. Veracity. Veracity is truthfulness. Truthfulness. You always have to use the tool of truth in dealing with your patients. A nurse must not be seen as a liar. You must always be truthful. So when you see A, it is A. People who are doing chat-free on the ward are not being truthful. Just because you are two nurses on the ward taking care of 50 patients doesn't mean that you have to do chat-free. You go and pick the TPR sheet and then do a raw chatting. Meanwhile, you have checked nothing. That is not being veracious. You always have to use the tool of veracity in dealing with your patients. You need to also ensure that whatever is going into your care, the patient is told, and the patient is sometimes we are doing medications and then the patient doesn't have medication A, and you have chatted that the patient has medication A. You are called that, oh, did you administer this medication to the patient? You know that this patient didn't have. You say yes. And then the person on the ward too also don't bother to administer the medication again because you have said that you have administered already. And just for the fact that you have lied, someone loses his or her life. Veracity is very, very important. If a patient comes to the ward and then the patient's condition or the prognosis of the patient is very bad, prognosis means outcome. The outcome of the condition means that it tells you that the person is going to die, and then relatives approach you and ask you, will this patient survive? As a nurse who is ethical and veracious, you must be able to tell the patient relatives that this patient, we will do our best to make sure that we will bring him to life, but the rest is in the hands of the Lord Almighty. You must be able to use the tool of veracity in reassuring your patients and also preparing your patient psychologically, including the family. Confidentiality is also about keeping the patient's information private. The patient's information must always be kept private. So you don't go gossiping. If you are a gossip as a nurse, you must discard it with immediate effect. It is not the time that you have seen the lady walk to the reproductive unit to patronize one of the family planning methods, and then immediately you get home, the girl living down your lane, because you know her, you start telling your siblings that this girl today came to my unit and the girl came to do IUD. So all her promiscuity is because she has done IUD. Oh, that girl, don't mind her. She is having no plans in place. That is why she is changing from one man to the other. It is not your business to be trumpeting patients' information about. Your business is to make sure that you are promoting health, promoting quality of life, and also protecting the health of your patients. So as student nurses, you must always make sure that you do not, at no point in time, will you be selling your patient's information to people who do not fall in the health line. Any moment that you will put out patient information, you are putting them out based on their consent, one, and also it has health implications to the patient. So for example, if a patient is on hard drugs, marijuana, patient comes to the hospital and confide in you and tell you that I'm on marijuana. What you have to do is that you need to seek for the patient consent that because you are on marijuana, there are certain medications, including analgesics, that when we give you the normal dose, it will not work. So let me tell the doctor that you are on marijuana so that we can increase the dose of medication or analgesic that we will prescribe for you. Otherwise, after the surgery, you continue to be in pain. If you explain to the patient in this manner, the patient understands, and then you lay the information to the doctor. Also, tell the doctor to also treat the information confidential. By that way, the patient will always be able to interact with you based on his or her secrecy. Okay, so significance of ethics. gives guidance for decision making about ethical matters by providing a set of values that are basic to nursing practice. So ethics always give guidance for decision making. Once you know that if this happens, this is what I should do. If this happens, what is what I should do? For example, if you know that it is ethical not to sell patients information, in a case where you are caught yourself in between, laying patient information for personal aggrandizement or something that will not benefit the patient, you will give yourself a pause and reconsider and not do so. So always, ethics help you in decision making. When you when you find yourself in a dilemma, ethics help you as to what to do. Ethics provide rules for behavior for every circumstance. It offers guidance about which values to take priority or how they can be balanced in practice. So what takes priority over the other? All of those are captured in ethics. Values and codes of ethics. We have providing safe, compassionate, competent, and ethical care. We have promoting health and well-being. We have promoting respect, informed decision-making, maintaining privacy and confidentiality, promoting justice and being accountable, tackling it one after the other, providing safe, compassionate, competent, and ethical care means that, just as you can see in the image, the nurse is making sure that the patient who is having a fractured hand is in a safe hand, and he is being compassionate. Look at how she has held the patient's hand, not in a rigorous manner, but with care. And the nurse is being competent by holding the fractured limb or hand with two hands and making sure that the patient is not in an unnecessary pain. Okay, so nurses value the ability to provide safe and compassionate, competent, and ethical care that allows them to fulfill their ethical and professional obligations to the people they serve. Okay, so providing safe and competent care is very, very important. Promoting health and well-being. Promoting health and well-being. Nurses value health promotion and well-being and assist patients to achieve their optimal level of health in situations of normal health, illness, injury, disability, or at the end of life. So with respect to promoting health and well-being, the nurses promote health through public health nurses. We as general nurses too, we have our role to play in promoting health by giving the patient who comes to our unit education. We promote health by telling the patient the things to do and the things not to do, educating the patient on signs and symptoms of their condition, telling and raising the patient's attention on some of the complications that the condition can come with if the person doesn't conform to treatment. You know, so when people are declining orthodox medicine to traditional medicine, it is the role of the nurse to promote health. You know, people come to the hospital and they want to, especially people having fracture, they want to go home and do traditional care. People have cancer, they want to go home and do herbal medicine. It is the role of the nurse to explain to the patient that if you do not go through this procedure, you can get this complication, you can get that complication, and when you come, you may lose a limb, especially in case of fracture. If you go and do the traditional and then the bone setter doesn't set the bone well, you can lose a limb as a result of that. It can result in deformity of your leg, and the formation of the bone will come with several complications. And the doctor will, a specialist will have to do another surgery for you, which may not be so good. So you have to promote health by giving the patient salient education, useful education that will help in their care. You need to promote respect-informed decision-making. Nurses provide persons with appropriate information and service so they can make informed decisions. Ensure nursing care is given with informed consent. Informed consent. So every procedure that you carry out, you must make sure that the patient has given you the go-ahead to do so. You just don't use your own prerogative to tell the patient that this will help you and so I'm doing it. In as much as that procedure that you are carrying out will help the patient, you still have to explain vividly to the patient and encourage the patient to consent to whatever procedure you want to carry out. So seeking for the patient consent is one of the ways of showing the patient respect. Preserving dignity. Recognize and respect the inherent worth of each person and advocate for respectful treatment of all persons. All persons are not the same in terms of finances. So someone can afford medication A, another person can afford medication B. Meanwhile, they are all doing the same work, but different prices. So it is your duty to also advocate for the patient that, oh, can this one be changed to that? Can that one be changed to this? To make sure that the patient is able to afford. You have to also advocate for the patient respectfully. You do not tend to look down on the patient because this patient can afford this and this patient cannot afford that. You need to make sure that you deal with the patient with some decorum. You need to watch the kind of words and your choice of words to use when you are dealing with patients. Maintaining privacy and confidentiality. Nurses safeguard the trust of clients that information learned in the context of a professional relationship is shared outside the healthcare team only with client's permission or as legally required, or where failure to disclose would cause significant harm. So maintaining privacy, as I've said earlier, means that you need to keep the patient's information confidential. If you will release the patient information, one, it must be that the release of the information is within the healthcare team. And also, it will benefit the patient health-wise. And again, it is based on the patient consent with which you are releasing that information. If a patient confides in you or you find out an information about the patient, you must make sure that you do not use the information against the patient, but rather to the benefit of the patient. So promoting justice, as I've said earlier on ethical principles, justice is one of the ethical principles, and you have to promote justice. You have to treat all persons equal, just as is captured in the Nurses' Pledge. You have to treat all manner of persons, regardless of their creed, and social status, equally. So if it is that if your mother is at the same unit where you work, you must make sure that you will treat your mother the same way you will treat the next person lying next to your mother. Someone will say, is that possible? But if you are treating someone well, if you are treating someone with all your might, and to the best possible way, you do not find any problem averting the same kind of treatment to your mother. It is when you are treating one patient badly, that is when you are careful not to avert the same kind of treatment to your mother. So if you are thinking of the care to give your mother and the care to give to the next person lying in the bed, it means that there is something wrong somewhere. You must make sure that the same commitment that you give to your mother is the same commitment that you give to the next person lying close to your mother. So you must make sure that as a nurse, you are justice. You use the tool of justice to exercise some equity in your practice. At no point in time must you be biased, or must you consider the rich over the poor, or must you consider the well-privileged over the less privileged. You must always make sure as a professional nurse that you are justice. You have to be accountable. In our practice as nurses, accountability is very, very important. That is why at the end of every shift, you account what you did in a form of handing over to the next nurse who is coming to take up. So you tell the nurse what you did. That is accounting. So you tell the nurse, I did this, I did that, I couldn't do this, I couldn't do that, I couldn't do that. And this is the reason, this is the reason, that is the reason. And then the nurse also takes up. And then the nurse will also carry out his or her duty and hand over. And also give reasons why he was able to do the things he was able to do and why he was not able to do the things he was unable to do. So as nurses, you have to be very, very accountable. When resources are handed over to you, very soon you become in charges of ward. When resources are handed over to you, you must make sure you use the resources equitably and also account for it expeditiously. All right. So definition of nursing standards. Describe the desirable and achievable level of performance expected of registered nurse in their practice against which performance can be measured. So we have a standard. The standard is provided by the Nursing and Midwifery Council of Ghana. They provide the standard of nursing. They tell you that this is a standard care, that is not a standard care. That is done by the Nursing and Midwifery Council. So nursing standard is measured against the existing standard as provided by the Nursing and Midwifery Council. And when we are talking about statutory bodies, we will talk about Nursing and Midwifery Council. All right. So 6 standards of nursing practice, 6 standards. Let's just quickly run through: accountability, continuing competence, application of knowledge, skills and knowledge and judgment, professional relationships and advocacy, professional leadership and self-regulation. These are the 6 standards of nursing practice. Okay. So right now, let's look at what an informed consent is. We are coming to look at certain terminologies and the ethical dilemma that it comes with. So informed consent. This is client's right to self-determination. It enables the client to make decisions from the care he or she is receiving. To determine preference, patient must have information about their condition, what treatment and alternation available. So especially when the patient comes to the reproductive unit and then you are telling the patient about the family planning methods, you have to first educate the patient on all the family planning methods, and now the patient makes an informed decision about which choice that he can patronize or can go easily with. And it must be observed that the patient always share their concerns and fears with nurse, and the nurse must listen carefully to identify whether the patient needs future information or clarification. So you must make sure that you pay attention to the details when you are educating a patient. You must also look at your patient's facial expression to determine whether what you are saying, telling the patient has understood or not. You have to allow time for questions, just as the procedure of educating a patient is. You have to allow time for questioning. You have to demonstrate to the patient the things that you are talking about so that it will enhance the patient's understanding. And if there's any questions, suggestions that the patient will have to come up with, you also take all that and discuss with the patient accordingly, just to ensure that before the patient makes a decision that, yes, I want to go into a surgery, the patient is well informed about the surgery he is going to do, the risk involved, and the benefits. Right, so clinical trial. Before any medication is given, you have to read thoroughly on the medication, whether it has been tested and tried and tested. At no point in time must you give a medication to a patient when you don't know the name of the medication. Some people withdraw medication and put it in a plunger and then even do not label it. You have to make sure that you have labeled the medication. The nurse who is administering must make sure that this medication is tried and tested. That is why they put in some notes for you to read. But if you want to hide anything from an African, put it in a document. We don't like reading, so we have to always be reading and abreasting ourselves with the issues so far as the medication is concerned. There is no point in time, at no point in time that must you administer a medication, you don't know the side effect, and then its indication. When I say indication, what the medication will do to the body. You must know all that, and also must ensure that the medication has passed clinical trial. Okay, so witnessing a will. With witnessing a will, for example, a patient has come to your ward. All these are ethical issues. Just an example of ethical issues. example of some of the issues that come with some ethical dilemma. Someone comes to the world and the person reports very ill and the person is likely to die. As a nurse who is on the ward, this person wants to make up a will. As a nurse on the ward, you have to witness the will, and the only thing that you have to do is by making sure that all the players involved in the will are present. The lawyer is there, some family members are there, and during that time, the nurse, you must take into consideration the time that the thing is happening. You must put down the date. You must report in the report book whatever happened and what the lawyer said, what the testator. The testator is the person making the will. What the testator said, and all of that must be well documented for future references. So, in witnessing a will, the nurse, your duty is not to involve yourself whether the man is being fair. Or why is it that this person is your elderly son, and then you are giving the big house to the second born, but not that is not your business. Your business in witnessing a will is to make sure that you have documented whatever transpired with the details, right? So, patient properties, how you handle patient properties. Okay, so someone came to the world with a suitcase full of gold. How do you handle that? Even to the minutest thing like ring, jewelries, dentures. How do you manage that? So these are personal valuables of the patient that is found on the day of admission. Some of these properties include dentures, rings, vital documents, jewelries, talisman, rosaries. Such valuables should be nicely wrapped and kept at the nurse's station for handing over. Okay, if the patient is conscious, seek for his or her consent before handing over valuables to the family. So if the person is fully conscious, you must ask the patient, should I hand it over to you, or I should give it to a patient relative? And if it's a patient, if it's a relative, who? You have to give the patient that opportunity to tell you who the valuable must be handed over to. If the patient is unconscious, hand over valuables with a nurse as a witness and another family member as a witness as well. So if I am the nurse handing over the valuable to the family, just because the patient is unconscious, I must make sure that another nurse is present with me. And then the family member that I'm handing over the property to, another witness who is a family member, is present with him or her, so that I can have a witness, he or she can also have a witness. Okay, so now let's talk about the nurse's pledge. We cannot talk about ethical issues without knowing what the nurse's pledge talks about. We have the nurse's pledge asked by Florence Nightingale, and that is not usually said, but the one that was written by a nursing author named Jude Akon is the one that the NMC has adapted and is being used in Ghana. So let's move on. All right, so this is the nurse's pledge that most of the times when you go for nursing interviews, you are asked to recite, and you must know the nurse's pledge. You must know the nurse's pledge. And you must absorb the words in you so that you always walk with them. I acknowledge that the special training I have received has prepared me as a responsible member of the community. Special training that you are receiving right now will prepare you to be a responsible member. So if after this training you are an irresponsible member, you are being unethical. An irresponsible member is that male nurse who go to hide in the village in a clinic and start doing abortions. That is an irresponsible member of the community. An irresponsible member of the community is that young nurse who lives in the community and she is being referred to as a promiscuous girl. The nurse's pledge will tell you that the things that you do must bring honor to the profession. And so if you are doing things that malign, put dust on the profession, it means that you are being unethical. So everything you do, even your dressing, must bring some kind of dignity to the profession. I promise to care for the sick with all the skill I possess, no matter what their race, creed, color, political or social status, sparing no effort to conserve life, alleviate pain, and promote health. This is talking about justice, ethical principle, justice. You have to be justice, no matter their race, no matter the creed, no matter the color, no matter the political or social status. You have to make sure you do all effort to conserve life, alleviate pain, and promote health. I promise to respect at all times the dignity of the patient in my charge. This is talking about autonomy, respect. You have to respect the patient. I promise to hold in confidence all personal information entrusted to me. This is talking about confidentiality. You must make sure that you keep the patient's information confidential. Right. I promise to keep my knowledge and skill at the professional level and to give the highest standard of nursing care to my patients. As a nurse, you must be abreast with issues. You must educate yourselves. Some of you have made up your mind that after the BSc, you are not going to school anymore. You are not updating your knowledge. And so it will get to a point in time, you work for 20 years, you cannot even construct one correct English sentence. As a nurse, you must be on top of issues. You must always make sure that you educate yourself. You will attend workshops, all to enhance and beef up your knowledge. That is why the NMC says that every year you must renew your PIN. And you just don't renew your PIN with the 50 Ghana cedis that they will take. You have to always submit an evidence that within the year you have attended a certain number of workshops that was calculated to build up your knowledge before they will renew your PIN. And a nurse who doesn't have a renewed PIN, a PIN that is updated, is not qualified to practice. And when you are caught, you will be in a very hot soup. Even your certificate can be terminated. Right. I promise to carry out intelligently and loyally medical instructions given to me. So note carefully, intelligently and loyally. So the nurse who always act to the quote-unquote whims and caprices of the doctor means that you are not carrying intelligently and loyally medical instructions. The nurse must carry out medical instructions intelligently. Intelligently means that you must compare and contrast what the doctor is telling you to do with your knowledge that you have. If the doctor is indicating a mishap or a wrongdoing, you have to bring the doctor back on track. You don't intervene in a doctor's instruction or plan knowing that it is wrong, and then you go ahead and then carry it out, knowing that it's just because the doctor has written. You and the doctor will be held responsible. So you have to carry the medical instruction with intelligence. And you have to also be very, very loyal. Loyal means that you are always dependable. You can be counted upon. So you have to always be very, very reliable in terms of issuing out medical instructions. I promise that my personal life shall at all times bring credit to my profession. So that's what I said earlier, that whatever you are doing as a nurse, you must always make sure that it is bringing credit to the profession in which you find yourself. I once found a nurse that was in uniform and carrying gas cylinder on her head. So I approached the nurse and greeted the nurse and colleague of the noble profession. The person was smiling and was shy of responding to me, yeah, because of what the person knew she was doing. You at no point in time must you be in your uniform and be carrying gas cylinder. You must not be in your uniform and be seen at public places like the market. people wear the nursing uniform just because when they go to buy condo, the woman will give them extra because they are wearing a nursing uniform. That is unethical. You must send your uniform to the hospital and work in it. You must also make sure that you have conformed to all the rules and regulations gathering the nursing uniform and wearing it. You must make sure the white cape, in the case of diploma, is white and nothing but white. It's not brown nor yellow, it's white. And you as nursing officers, your uniform is all white, and you must make sure it is all white and nothing but white. Some of you have several shades of colors. You must make sure you repent from those shades of colors because it doesn't speak well of you. So, some of the things that you can also do to bring credit to your profession is that you have to always make sure that you are being a responsible member of the community. You give care to the patient. You don't talk to patients anyhow. You talk to the patient, and then just with your mere speech, before medication, the patient is already well. The nursing profession is gaining its feet gradually just because of some irresponsible few ones who are just doing things to discredit the profession. We must make sure that we do certain things very quick just to bring back the dignity of the profession. I promise to share in the responsibility of other professions and citizens for promoting health locally, nationally, and internationally. So, as nurses, we prepare you to be able to fit in the international scene. We prepare you to be able to fit everywhere you go. That is why nurses from Ghana go to sit for international exams and then they pass. Because there are some of the things that they are exposed to, which in the international scene is also being done, even though it's being done differently, and then they might have other advanced equipment that we do not have. We also make sure that we somehow meet them at a point so that our nurses will not in any way fall short when they meet them on the international level. So as a nurse, you must make sure that you will be a nurse that fits locally, you will be a nurse that fits nationally, and then internationally. So help all of us. All right. So identification of coroner's case, an autopsy and inquest. So which case qualifies to be a coroner's case? What is an autopsy? What is an inquest? Okay, so a coroner is defined as an official responsible for investigation of violent, sudden or suspicious deaths. The coroner can be a public officer or a medical examiner. So that is a coroner. Coroner's inquest is an official investigation to find out the cause of death, especially when it has not naturally occurred, so it's suspicious. In the hospital, coroner's case, death of a patient outside the hospital or within the hospital or within 24 hours after admission. So if a suspicious death happens within the hospital under 24 hours, that is termed a coroner's case. Even if it is under 48 hours and yet it is suspicious, it qualifies to be a coroner's case. Even if it is within 72 hours and it's suspicious. So for example, what do I mean by suspicious? If a patient is a known hypertensive and the patient gets hypertension emergency and the person is rushed to the hospital and the person dies, that cannot be a suspicious death. Even though it might have occurred under 24 hours, which it is a coroner's case. But it cannot be a suspicious death because this person has an underlying sickness that caused the person's death. But a suspicious death is when the person doesn't have any form of illness and yet the person is reported to the hospital and for whatever reason the person dies. So all accident cases where death occurs under 48 or 24 hours qualifies to be coroner's case. So because An accident victim may be someone who is very well, and yet the person is knocked down by a vehicle. The person gets to the hospital, and suddenly the person pops off. An investigation has to be conducted to ascertain what really killed the person, even though we know the person has been knocked down, but what condition killed the person. Okay, so such cases need to be investigated to know the cause of death through performance of a post-mortem or autopsy. A pathologist usually performs the autopsy. The duty of the nurse in the management of coroner's case is to give accurate information of the patient in regards to date, time, condition of patient on arrival at the hospital, and general observation done on the patient, including therapies started by the medical officer. Okay, factors that require coroner. So where the person died either in a street, house, hospital, classroom, or incomplete building qualifies to be a coroner. How the person died, whether by knife, gunshot, beating up, instant justice, and we all know, slaughtering, food, and drinking poison or drink poisoning. When the person died, the duration and time all qualifies a patient or a patient body to be declared a coroner or a coroner's case. Okay, so inquest may be an inquiry that are necessary to establish the cause of death. This include ordering for an autopsy, obtaining witness statement, and medical records is termed inquest. Okay. So autopsy is an official examination of the dead body by a pathologist in order to discover the cause of death. So autopsy is the same as post-mortem. A written and verbal report is sent to the police or investigator by the pathologist or medical personnel. So an official examination of the dead body by a pathologist in order to discover the cause of death is what we refer to as autopsy. Spiritual care dimension. You know, we have captured spiritual care dimension because we have learned about holistic nursing care. And with holistic nursing care, physical care is part, psychological care is part, physiological care is part, socioeconomic. Usually what the nurse do not carry out well, especially in a part of the world where we are spiritual animals. When you were set out in the morning and you hit your leg against a stone, you associate it with how your grandmother looked at you when you were stepping out and associate with witchcraft. Such people must be well prepared and situated in issuing our spiritual care to their patients. In Africa, everything has a spiritual connotation, and as nurses that we are going to deal with human beings, we must make sure that we are spiritually positioned to care for the patient. So what are some of the spiritual care dimensions that we need to consider so far as ethics is concerned? Spiritual care forms part of the holistic patient care, care rendered to the patient. Spiritual care equally helps in the patient care delivery and must be given utmost attention. Spiritual care is the care given to patient in a personal quest for understanding and answering ultimate questions about life, give meaning and relationships that are sacred. Right, so assessment of spiritual care needs of the patient. Find out about the client's religious affiliation. So if you want to know about the spiritual care needs of the patient, you must know the client's religious affiliation. Whether the person is a Hindu or a Buddhist, or a person is a Christian, Islam, or a traditionalist, you must know. You have to find out the level of commitment of the client through dialoguing. So if you talk to the person and then every sentence goes by God's grace. By God's grace, you must know the person is a Christian. And every sentence ends with Inshallah, Inshallah. You must know the person is an Islam or a Muslim. If the person keeps mentioning the name of a shrine, you must know where the person is coming from, and so on and so forth. You have to also look out for certain artifacts like rosary, talisman, Bible, church wristband, and the likes. Talk to the patient on his belief, and do not try to introduce him or her to different belief whilst under your care. So it is not on the ward where the patient is under your care. That is when you are going to talk to the person about how Christ came to suffer on the cross when you know the person is a Muslim. You don't talk to the person about Christianity when you know the person is a Muslim. Sometimes nurses want to compromise the patient on their belief. If you are a Christian, you have to keep your Christianity to yourself and make sure that you respect the religion of your patient. It is not by force for the patient to believe in what you believe. Most of the times, if we try to talk to Muslims who are under our care as Christians or about things concerning Christianity, they are forced to compromise and cooperate with us because they feel they are under our care, and it is unprofessional. It's unethical. You have to always make sure that you are religiously tolerant so that you are able to tolerate other people's religion and deal with them as it is. Do not sound judgmental when dealing with the patient's religion. I have encountered some nurses that they look down upon people just because they are coming from another religion. And these people, that is how they are. That people, that is how they are. They always behave in a certain manner. Just because you do not share in the person's faith, you try to malign the faith. That is unethical. You have to always make sure that you will treat people who do not share in the same faith as you with some dignity. Assist patient in any spiritual support if feasible and not contraindicated to the condition. So far as the spiritual request is not contraindicated to the person's condition. For example, if a patient comes to the ward and tell you that they have been to a pastor and the pastor says they should spread sand on their bed, that one is contraindicatory to the patient's condition, because spreading sand on the bed and the patient lying in it can expose the patient to pressure sores. And so you cannot allow that thing to go on once it's contraindicated to the patient's condition. If a patient comes to the ward and, if patient relatives come to the ward, they tell you, we have gone for asking, we have gone to inquire, and they said that if he start drinking this oil, not as a nurse, not knowing the ingredients, the active ingredients in the oil, you must not allow that patient to drink that oil. At no point in time must you allow any patient to eat any concoction just because it has a spiritual connotation. If the concoction is drunk and it results in death, you are being unethical and you can be held accountable. So belief about health. How certain faiths see health. We want to, as nurses that provide care to patients, we are likely to get people that are from the that are Hindus, people that are Buddhist. We can get people that are Islamic, Muslims. We can get people that are Christians. So let's look at how they perceive health. How they perceive health. Hindus believe that praying for health is the lowest form of prayer. Thus, they tend to dismiss or be concerned about body ills. So for them, praying for someone who is sick is very, very low. It's below the belt for them. They believe in modern medical sciences. They believe that if someone is sick, you must send the person to the hospital. The devotees of Buddhism have rich multi-religious influence from Confucianism, Christianity, Shintoism. These are all forms of religion. Followers of Hindus and Buddhists usually accept modern medical sciences. So the Buddhists too also accept modern medical sciences and do not tend to use prayer in solving health issues. Islam, the believer is considered a unique individual with eternal soul. Muslims pray 5 times a day, facing Mecca. Older or more conservative Muslims may have fatalistic view and may resist compliance with medical treatment. So even though most Muslims or the Islamic religion as a whole believe in modern medical sciences, they hold certain reservations. And sometimes they are able to resist medical care. For example, if you speak to a Muslim about family planning, the person will not heed to your call because they do not believe in it. Okay, so if you enter into an Islamic community and you start talking to them about using of condom and IUDs and all that, by the time you realize, the chief imam will call you and tell you that you have to exit their community with immediate effect because they do not believe in family planning. If you talk about setting for example, alcohol, which is very good. The Islamic community do not drink, and so which is very good. It's of benefit. But there are other things that they do not believe in, that they are likely to impede you in giving them health. And that is one example is what I've cited with family planning. They are not likely to conform so far as family planning is concerned. Right. So the Jewish person believe in the sanctity of life. The basic principle overrides any conflicting belief and promote acceptance of medical science. So the Jewish also believe in modern medical sciences. Right. Observance of Sabbath regulation may conflict with scheduled therapeutic procedures. So once the person is a Sabbath and then it is conflicting with the person's Sabbath, the person is not likely to conform. But so far as the Sabbath is concerned, they do not really impede health. The Sabbaths usually are concerned about their Saturdays. They do not want to work on Saturdays. They want to observe it wholly. And so when you are dealing with a patient who is a Sabbath and it is on a Saturday, you have to know how to go about dealing with such patients. Christians generally regard themselves as children of God, redeemed by Christ and destined for eternal life. They seek discern of the will of God in life and suffering. But their belief generally do not conflict with modern medical sciences. So if you take certain Christian faith, like the Roman Catholics, they have their own reservation when it comes to modern medical sciences. But generally, Christians believe in modern medical sciences and do not resist them. Okay, so religious belief about death. So far as the Hindus is concerned, they believe in rebirth. After death, certain rites are performed. The priest may tie a thread around the neck or a wrist to indicate blessing. They pour water into the mouth. The family washes the body before it is cremated. So they believe in cremation, burning of the body. So the Hindus believe in rebirth. They believe in rebirth. So if you are a health provider and then you get someone who is a Hindu or belongs to the Hindu faith, you must make sure that you will cooperate, knowing this. So when they come and then they try to request for some of these things that we have said in class, you must make sure that you will remember some of these things, and then always make sure that so far as it does not contraindicate to the patient's condition, or in the case of a death, it doesn't have any ethical breach, you will cooperate. If they want to cut certain portions of the person's body and no family member is around, there is no way you can accept that. So you have to always make sure that you are present when a death occurs and the Hindu people are around and they want to perform certain rituals. As a nurse, you must be standing there with eyes open wide, observing whatever is going on. And when they go contrary to what you expect them to do, you draw their attention with no fears. Buddhists may wish to call a priest at the time of death. Last rite chanting is often practiced at the bedside. So they all believe in those death rites. They come to the ward, immediately death is clinically confirmed, and then they perform certain rites even before the person is taken to the mortuary. So you must always make sure that you are present right there when those rituals are being performed on the dead. Before death, the Islam client confesses sin and asks for forgiveness of the family. After death, the family washes the body, and then turns the body towards Mecca. Body is buried someday and usually do not accept autopsy. We all know that Muslims like to bury their body the very day the death occurs, and they usually do not believe in autopsy. They only do autopsy when it is legal, when they are obliged. In the case of coroner's case, They do not have an option. Once there's a suspicious death, a coroner has to come in. So for that matter, they will have to hold on. But depending on the protocol of the hospital, that is when you will be allowed to give the body to them right there and then, or some hospitals believe that, has as a protocol that once death occurs, the body must be sent to a mini morgue. The main mortuary must come to collect, and then the family will finally go to collect at the main mortuary. That is for some hospitals. With other hospitals that do not have a mortuary, the body can be handed over to the family on the ward. So depending on the facility that you find yourself, that will determine the kind of protocol you will observe. So in the case of a Muslim dying on your ward, you have to always make sure that you will observe the protocols. If the protocol says that you have to hand over the body, you have to hand over the body. If the protocol says that they have to go through the system and collect finally at the mortuary, you have to do so. Again, if it is a coroner's case, they cannot bury on the same day. You, as a nurse, you must be able to explain to them that when you can testify that when you brought the patient to the ward, the person didn't last for 24 hours and the person died. Once the person didn't last for 24 hours and the person died, it is declared coroner. And so the government has to come in. Papers must be signed and must be filled and signed and sent to the court for an inquest to be taken, so that a subsequent autopsy will be done on the patient to ascertain death before the body can be handed over to you. So all of these things must be taken into consideration before you hand over a dead body to the Muslim. As with Hindu, only relatives and friends touch the body. No autopsy is performed unless required by law. As I've said earlier, any group of belief do not have any option so far as law comes in. But if there is no law, you allow their religion and their belief to persist. Orthodox Jews and some conservative Jews also oppose autopsy and cremation. Human remains sometimes must be cleansed by members of a ritual burial society, and burial is always carried out as soon as possible. Due to variation in custom, nurse must always consult the deceased family to determine preference. So with the Christian faith, no ritual is performed. No rituals, as in what happens with the Hindus and the Buddhists and the Jewish. No particular ritual is performed, but with burial services and those things, it happens. But that doesn't happen in the hospital. You know, they do their funeral preparations and rites at the mortuary, cemetery, but not in the hospital. Christians do not have any particular rituals they perform on the body soon after death is declared. And for them, they will allow the body to go through protocol without any interruptions. Unlike the Islamic faith, that they always want to have their body the very day death is declared. So as nurses, knowing all of these faiths and what they believe in, if you find a patient on the ward with such a belief, you must be able to know what to do. Just as we said earlier that ethical issues help you come out from clinical dilemmas that may happen on the ward. So far as ethics is concerned, we have spoken about the definition of ethics, we have spoken about the standards of nursing practice, we've spoken about clinical trial, we've spoken about the spiritual care dimension, we've talked about coroner's case, we've talked about the various beliefs, and so far as ethics is concerned, how you have to readjust yourself as nurses. So we will move on quickly to communication as the next lesson.